everyone! Today we will having a new topic to discuss. Very interesting, right? But before that, let me introduce to you myself first. My name is Rushila Resuelo, and to formal start our discussion, let me introduce to you my members coming from Group 7. We have Diana Panoncio, Eliza Kyle Palisok, Lilibet Munoz, Desiree Posadas, and Beverly Munoz. Our topic is all about ASD and ADHD. First, let us find out what is ASD. ASD, also known as Autism Spectrum Disorder, is a developmental disorder characterized by communication, social, and behavior challenges. The condition is lifelong and symptoms can vary considerably from one person to the next. Meaning to say, it is characterized by a range of symptoms that can vary widely among individuals. For your information, this autism cannot be cured because it is not a disease. It has an inborn neurological difference which causes difficulties in many areas but also has neutral and even positive aspects. Autistic people commonly experience problems with the three different areas, and there are: first, developmentally appropriate social communication skills; second, restricted repetitive pattern of behavior, interests, or activities; third, unusually intense or sensitive behaviors. A term that referred to an individual with marked challenges with social interaction and in communication. There are cannot speak, sometimes there are delayed in speaking, repetitive behaviors, disrupted sleeping or eating behaviors, and a predisposition to tantrums or meltdowns. It was really corresponded with a more severe autism spectrum disorder diagnosis. Autistic children can have varying degrees of symptoms. These symptoms may be different for each person with autism spectrum disorder. They may range from mild to severe and can change over time. Some people will need a lot of help throughout their lives. And these are the different types of autism spectrum disorder. And there are: first, classic autistic; second, childhood disintegrative disorder; third, Asperger's syndrome; fourth, Rett syndrome; and lastly, pervasive developmental disorder not otherwise specified. Let us know what is classic autistic. As autism with often moderate severe developmental and or language delays. People who are classically autistic is different from most other forms of different types of autism, and that is include a narrow set of behaviors, such as severe problems communicating because they are late to develop a language, they are struggling to communicate to other people, severe problems interacting with others, severe problems taking care of oneself. As a result, people with classic autistic become increasingly disabled over time unless they receive extensive support throughout their lives. The next one, childhood disintegrative disorder, is a condition where a child develops normally and achieves appropriate milestone up to the age of 4 and then begins to regress in both developmental and behavioral milestone and lost the skill they already learned, with the loss of skill plateauing around the age of 10. Children who were diagnosed with childhood disintegrative disorder typically range in the age from 4 to 12 years old. This means that all areas of developmental including language skills, social skills, physical skills begin regressing around the age at which most children are gaining these skills. As children reach different developmental milestones, other skills such as cognitive thinking skills and reasoning skills also begin to decline. The next one, Asperger's syndrome, a rare genetic, neurological, and developmental disorder that affects the way the brain develops. A young people with Asperger's syndrome is a kind of autism that is considered as high functioning, can be very smart, and can focus on abstract problems much better than a normal person. A person without language delay and without intellectual disability, and at the same time, they know exactly what's going on in the mind of someone with severe autism because they experience the same feeling. Many of best mathematicians, physicists, artists, and programmers are in this category. They tend to have an exorbitant vocabulary to read a lot, can think very rationally. Of course, not all high-functioning autists are very intelligent. They are very often hypersensitive to noise and smell and create their own system of understanding the world. The next one, Rett syndrome, a rare genetic disorder that affects brain development and causes severe physical and mental disability from early childhood. Is a rare genetic disorder that affects brain development, resulting in severe mental and physical disability. This disorder causes a progressive loss of motor skills and language. Mostly occurs in female marked by poor head growth, loss of muscle. It affects all body movement. They may lose their ability to walk and loss of purposeful hand use. Lastly, pervasive developmental disorder is a subtype of autism spectrum disorder, but we should note the pervasive developmental disorder in individuals who met some but not all criteria of ASD. Was a term used to describe disorder that show many symptoms of autism but do not fully meet the criteria of any one autism spectrum disorder. A person with pervasive development disorder struggles with socializing and communication in noticeable way due to delayed development. However, PDD kids do not have the other symptoms of autism like sensory processing issues. They are similar to autistic person but not on the autism spectrum, but may not qualify for a diagnosis of autism spectrum disorder or Asperger's syndrome. Autism can mean a lot of things in different people. It means that your brain functions differently than in most other people. You can distinguish the different kinds of autism either by particular things that are different or by how well the autistic person can do things in their life. The different kinds of autism spectrum disorder are generally grouped into 3 different levels based on their severity. Level 1, high functioning. Level 2, low functioning. Level 3, classic autism. Individuals with different kinds of ASD usually have specific issues in at least some parts of language, communication, social skills, or behavior, although not always in all areas to the same degree. The level 1 high functioning is a mildest of highest functioning forms of autism, which includes those who would have previously been diagnosed with Asperger's syndrome. Individuals with ASD level 1 may have difficulty understand social cues and may struggle to form the maintain personal relationship. The people who have high functioning autism typically cannot communicate well verbally and tend to be withdrawn from social interaction. Also avoid eye contact and interaction with other people and prefer to spend time alone rather than with others. Their behavior might seem odd because they may not make sense when they speak or may not be able to carry on a conversation. However, unlike people who have classic autism, people with high-functioning autism usually want to interact socially, but cannot do effectively because of their poor communication skills. Level 2 low functioning. People with level 2 autism usually require more support. Often, they all require speech therapy, social skills training, and other counseling therapy treatment to function the best of their ability. People with low functioning autism typically have a very difficult time communicating verbally and may have limited speech or even unable to speak at all. They often have severe behavior problems as well, such as frequently running away from home or attacking other people or self-injury. They also may not respond to their names and often prefer able alone rather than interacting socially with others. Autism patients with low functioning require a lot of assistance in caring for themselves because they are unable to communicate what they need. Low functioning people also act very young for their age, both in terms of social skills and communication abilities. Lastly, level 3 characterized by severe challenges in social communication as well as extremely inflexible behavior. People with classic autism typically have severe communication problems, including very limited speech. They also tend to be withdrawn socially and spend much of their time alone doing repetitive things. People with ASD share some similar symptoms such as problems and social interaction, but each person may experience symptoms differently.
Common traits of autism is a spectrum disorder, meaning that individuals can experience a wide range of symptoms and behaviors, and severity of these traits can vary greatly from person to person. Additionally, many individuals with autism also possess unique strengths and talents that should be recognized and supported. Early intervention, personalized support, and acceptance are key in helping individuals with autism drive and reach their full potential. In this slide, these signs may indicate difficulties in communication, social interaction, and sensory processing. Early intervention and support are crucial for children, showing the signs to help them reach their full potential. If you have concern about a child's development, it's important to consult with a healthcare professional for evaluation and guidance. These signs may indicate difficulties in communication, social interaction, and sensory processing. Early intervention and support are crucial for children, showing these signs to help them reach their full potential. In these next slides, we have rare traits in autism. First is seizures. Seizures are sudden, uncontrolled electrical disturbance in the brain. They can cause a wide range of symptoms, from temporary confusion and stirring spills to convulsion and loss of consciousness. Seizures can be caused by various factors, including epilepsy, brain injury, infection, or genetic condition. And we have intellectual disability. Intellectual disability, formerly known as mental retardation, refers to significant limitation in intellectual functioning and adaptive behavior. It affects a person's ability to learn, communicate, and perform daily tasks. The severity of intellectual disability can vary widely, and it may be caused by genetic factors, brain injury, or environmental influences. We have synesthesia. Synesthesia is a neurological condition in which stimulation of one sensory or cognitive pathway leads to involuntary experience in a second sensory or cognitive pathway. For example, someone with synesthesia may perceive letters or numbers as having a specific color, shapes, and not consider a disorder but rather a variation in perception. Third, we have Savant syndrome. Savant syndrome is a rare condition in which a person with a developmental or intellectual disability demonstrates exceptional abilities in a specific area, such as music or mathematics or memory. Individuals with the Savant syndrome often have extraordinary skills but may also have significant limitations in other areas of functioning. Next is hyperlexia. Hyperlexia is a condition characterized by an early and intense interest in reading, often accompanied by advanced reading skills at a young age. However, individuals with hyperlexia may have difficulty understanding spoken language and social interaction. It's often associated with autism spectrum disorder but can also occur independently. Fifth is low muscle tone and or difficulties with fine and cross motor skills. Low muscle tone, also known as hypotonia, refers to reduced tension or resistance in muscles, leading to decreased strength and control. Difficulties with fine motor skills involve tasks that require precise movement, such as writing or buttoning a shirt, while cross motor skills involve larger movement like walking or jumping. In these next slides, we have physical traits. First is sleeplessness. Sleeplessness or insomnia is a sleep disorder characterized by difficulty falling asleep, staying asleep, or waking up too early and not being able to go back to sleep. It can lead to daytime fatigue, irritability, difficulty concentrating, and other physical and mental health problems. Cause of insomnia can include stress, anxiety, depression, medical condition, medication, and lifestyle factors. Second, we have epilepsy. Is a neurological disorder characterized by recurrent seizures which are sudden and uncontrolled. Electrical disturbances in the brain. Seizures can vary widely in a type as severity, ranging from brief staring spells to convulsion and loss of consciousness. In addition to seizures, epilepsy can also be associated with other physical symptoms such as muscle stiffness, jerkings, movements, loss of bladder or bowel control, and injuries from fall during seizures. Third, we have gastrointestinal issues. Gastrointestinal issues refers to problems affecting the digestive system, including the stomach, intestine, and other organs involved in digestion. Common GI issues can include abdominal pain, bloating, diarrhea, constipation, acid reflux, nausea, vomiting, and gastrointestinal bleeding. In these slides, we have what are traits of mild autism. This is the level 1. Level 1 describes people who need the lead support for the activities of daily life. This is what some call mild autism. In these slides, we have support needed person with level 1 autism might be include. For a person with level 1 autism, also known as high-functioning autism or Asperger's syndrome, support may focus on building self-control strategies to help the individual regulate their impulses, manage their behaviors, and make appropriate choices. And in various situations, this may involve teaching techniques such as deep breathing, mindfulness, or using visual cues to encourage self-monitoring. Second, we have controlling emotions, helping the person recognize and understand their emotion as well as developing coping mechanisms to manage intense feelings. This could involve teaching relaxation techniques, social stories, or providing a safe space for expressing emotions. Third, we have being flexible, assisting the individual in adapting to changes in routines or unexpected events, which can be challenging for someone with autism. This may include using visual schedule, providing advance notice of changes, and gradually introducing new situations to build flexibility. Fourth, we have understanding nonverbal communication, teaching the person to recognize and interpret nonverbal cues such as facial expression, body language, and tone of voice. This could involve explicit instruction, role-playing scenarios, and practicing social interaction in various settings. Last, we have reducing anxiety, implementing strategies to alleviate anxiety and sensory overload, which are common challenges for individuals with autism. This may involve creating a calming environment, teaching relaxation techniques, and providing support to manage sensory sensitivities. In these slides, we understanding these traits can help individuals with mild autism and those around them navigate social interactions more effectively and create supportive environments that foster social connection and inclusion. In these next slides, we have attached to routine. A specific way of doing things often brings feeling or security. Any changes to this routine can cause them to react in an emotional way. attached to routine. Children with mild autism often prefer routines and predictability in their daily activities. They may feel more comfortable and secure with their environment and schedule remain consistent. Any disruption or deviation from their established routine can cause distress or anxiety. Next, we have limit in adapting to change. Children with mild autism may find it challenging to adapt to change in their environment, schedule, or routines. They may become anxious, agitated, or upset with faced with unexpected changes. In this topic, mild autism traits in adults often include a strong need for planning and routine, as well as a dislike of change. This can manifest as a preference for predictability and difficulty adapting to unexpected alteration in their environment or schedule.
Let us know the treatment for autism with high support needs. We have 6 therapies. We have speech therapy, occupational therapy, physical therapy, play therapy, behavioral therapy, and specific condition treatment. Speech therapy for autistic children with low support needs is usually focused on conversation skills and learning to understand body language. It emphasizes enhancing communication and social interaction skills. This may include working on conversation skills, understanding nonverbal cues such as body language and facial expressions. This goal is to help children navigate social situations more effectively and engage in meaningful interactions with others. Next is occupational therapy. Is often helpful for challenges that many autistic children face. Occupational therapy is frequently utilized to address sensory challenges in autistic children. Occupational therapies work to help children regulate sensory input, manage sensitivities, and developing coping strategies. The goal is to enhance the child's ability to engage in daily activities and navigate sensory experience more comfortably. Physical therapy. Many autistic children have low muscle tone and struggle with physical activities. It is beneficial for autistic children who experience challenges with low muscle tone. Physical therapists can design interventions to improve muscle strength, coordination, and overall motor skills. These therapies aim to enhance the child's physical abilities, making it easier for them to participate in various activities and improve overall quality of life. Play therapy. This therapy uses play-based activities to build an autistic child's emotional and communication skills. Play therapy is a therapeutic approach that utilizes play-based activities to help autistic children develop emotional and communication skills. Through structured play sessions, therapists create a supportive environment where children can express themselves, improve social interactions, and enhance language abilities. Play therapy can be particularly effective in addressing emotional challenges and fostering positive communication in a way that is engaging and comfortable for the child. Behavioral therapy for autism often employ a technique called applied behavior analysis or ABA. This approach involves using positive reinforcement such as rewards to encourage and reinforce desired behavior in autistic children. ABA or ABA focuses on breaking down complex skills into smaller tasks, providing consistent feedback and systematically reinforcing positive behaviors. This method is structured and goal-oriented aiming to promote meaningful behavior change and skill acquisition in individuals with autism. And lastly, specific condition treatment. Autistic kids also need to be treated for any other physical or mental health conditions they have. For example, seizures, gastrointestinal disorders, sleep disorders, anxiety, obsessive compulsive disorders, commonly occur with autism. Specific condition treatment, medical professionals often work to manage conditions like what I mentioned earlier, which commonly accompany autism. A comprehensive approach that considers both the core symptoms of autism and also associated health condition can significantly improve the well-being and quality for life for individuals on the autism spectrum. So let us know about ADHD or attention deficit hyperactivity. ADHD or attention deficit hyperactivity disorder is a condition for children to pay attention and or control their behavior. It is neurodevelopmental condition that can make it challenging for individuals, particularly children, to pay attention, control impulsive behavior, and regulate activity levels. ADHD is characterized by inattention, hyperactivity, and impulsivity, and it can impact various aspects of a person's daily life, including academic performance, social interactions, and daily routines. Treatment approaches often include behavior interventions, medication, and support strategies to help individuals manage symptoms and improve functioning. Cause of ADHD. The possible causes and risk factors including brain injury, exposure to environmental risk during pregnancy or at a young age, alcohol and tobacco use during pregnancy. ADHD or attention deficit hyperactivity disorder is believed to have a combination of genetic, environmental, and neurological factors contributing to its development. Genetic plays a significant role with ADHD often running in families. Additionally, factors such as exposures to toxins during pregnancy, premature birth, low birth weight, brain injuries, and certain environmental influences may also increase risk of developing ADHD.
Two types of behavioral problems. Number one, inattentiveness, difficulty concentrating and focusing. Number two, hyperactivity and impulsiveness. So, I will first discuss about inattentiveness, difficulty concentrating and focusing. So, what is inattentiveness? Inattentiveness is commonly referred to a difficulty concentrating and focusing. It's a condition characterized by a lack of focus, distractibility, forgetfulness, and an inability to maintain attention on a task or activity. It can manifest in various ways, can be caused by a variety of factors, including stress, anxiety, depression, ADHD, sleep disorders, or even certain medications. If you find yourself experiencing these symptoms frequently, it may be helpful to consult with a healthcare professional for further evaluation and guidance on managing your symptoms. The main signs of inattentiveness are: number one, having a short attention span and being easily distracted. Number two, appearing forgetfulness or losing things. Number three, making careless mistakes. Number four, being unable to stick to tasks that are tedious or time-consuming. And number five, constantly changing activity or task. Number six, having difficulty organizing tasks. Next, I will discuss about hyperactivity and impulsiveness. So what is hyperactivity and impulsiveness? Hyperactivity and impulsiveness are two common symptoms often associated with attention deficit hyperactivity disorder or ADHD. Hyperactivity refers to excessive and relentless physical movement. This can be manifest as constant fidgeting, inability to sit still, or a tendency to talk excessively. So, impulsive men, on the other hand, release to acting without thinking about the consequences. Those with impulsive men may have difficulty controlling their immediate reactions or responses to situations, leading to actions that are risky and inappropriate. It's important to note that hyperactivity in impulsive men can also occur independently of ADHD and may have different underlying causes and other concerns. If you or someone you know is experiencing symptoms of hyperactivity in impulsive men that are impacting daily life, it's advisable to seek guidance from a healthcare professional for proper evaluation and support. Hyperactivity in impulsive men are: number one, being unable to sit still, especially in calm or quiet surroundings. Number two, constantly giddy. Number three, being unable to concentrate on tasks. Number four, excessive physical movement. Number five, excessive speaking. Number six, being unable to wait their turn. Number seven, acting without thinking. Number eight, interrupting conversation. Or number nine, litter or nonsense of danger. For someone experiencing inattentiveness, difficulty concentrating and focusing, along with hyperactivity and impulsiveness, there are several strategies that may help manage their behavioral problems. So number one, establish a routine. Creating a consistent daily schedule can help improve focus and reduce impulsivity by providing structure and predictability. Number two, break tasks into smaller steps. Breaking down tasks into smaller manageable steps will make them less overwhelming and easily to focus on. Number three, use visual reminders. Visual calls such as calendar, doodle list, and reminder can help keep track to tasks and stay organized. Number four, minimize distractions. Creating a quick, organized workplace and reducing distractions such as noise or clutter can help improve focus. Number five, practice mindfulness and relaxation. Techniques, mindfulness, meditation, deep breathing exercise, or yoga can help increase attention and reduce impulsivity. Number six, seek support. Consider consulting a healthcare professional for our evaluation and potential treatment options such as therapy or medication. It's essential to remember that every individual is unique, so finding the right strategy may require some trial and error. Working closely with a healthcare provider or mental health professional can help tailor a plan that best suits that individual's needs.
There are 7 types of ADHD. First is classic ADD, which is characterized by symptoms inattention, hyperactivity, and impulsivity. Classic ADD is the type that most people are familiar with. Those type of people tend to be very hyperactive and impulsive. They can be very easily distracted, disorganized, and forgetful. Also, being restless and fidgety, that's another classic symptoms. They also tend to interrupt people's conversation. Second is inattentive ADD, also known as ADHD, predominantly inattentive presentation, is a subtype of ADHD presentation where individuals primarily struggle with inattention and may not display hyperactivity and impulsivity. This is the second common type of ADD. This is the person that tends to daydream a lot. They are introverted and typically if they are not hyperactive, then this is the type that tends to get misdiagnosed the most. Also, these people tend to complain of being tired and feeling sluggish. Third is overfocus ADD. It's a subtype of ADHD where individuals have difficulty in shifting attention from one task to another, tend to get stuck on thoughts or tasks, and may exhibit obsessive tendencies. In short, these people tend to be inattentive, they get overly focused on a certain aspect in their life, and get stuck in frequent negative loops inside their own head. These people tend to be very obsessive and they are not very flexible in their thinking at times. Also, they tend to be very argumentative and like to have contention at times. They can deal with argumentative behavior. The fourth is temporal lobe ADD, refers to a subtype of ADHD that involves difficulties with memory, learning, and emotional regulation due to distinction in the temporal lobe of the brain. This type of ADHD, these people deal with things like being inattentive or distracted and having issues with focus. But one of the biggest things that sets this type of ADHD apart from the other ones is the fact that this person can tend to have a short fuse at times. They can even deal with dark thoughts. Next is limbic ADD. Is a subtype of ADHD associated with heightened emotional sensitivity, mood swing, and strong emotional reactions. Limbic ADD are people tend to deal with a glass empty type syndrome. These people also tend to isolate themselves a lot, and they tend to just deal with daily feelings and worthlessness and hopelessness. Type 6 is Ring of Fire ADD. Also known as ADHD+, is a subtype characterized by emotional intensity, sensory sensitivity, and overstimulation, often accompanied by mood instability. It is called the Ring of Fire because when you do a particular scan on these people's brain, the brain looks like it is on fire because all the areas of the brain are involved for this person, unfortunately, and this type of people tend to have all of the symptoms with ADD like the distractedness, attentiveness, focus, and they also deal with up and down emotions. The last type is anxious ADD. Is a subtype of ADHD where anxiety plays a significant role, leading to symptoms such as restlessness, worry, and fear. This type of ADD has all the classic symptoms of inattentiveness, disorganized, forgetfulness, all these fun things with ADHD, but the biggest difference that with this one is, as you can guess it, there's a lot of anxiety with this type of person. This person tends to predict the worst, and there's a lot of anxiety in social settings or in testing situations. And another big difference with this type of ADHD is person will tend to have physical symptoms like headaches and stomach aches.
Of the 5 conditions in children and teenagers with ADHD. First is anxiety disorder. Second, oppositional defiant disorder. Third, conduct disorder. Fourth, sleep problems. And the last is dyspraxia. What is the anxiety disorder? Anxiety disorder in which causes your child to worry and be nervous much of the time. It may also cause physical symptoms such as a rapid heartbeat, sweating, and dizziness. For example, in the generalized anxiety disorder, panic disorder, and social anxiety disorder. The second is oppositional defiant disorder or ODD. ODD means defined by negative and disruptive behavior, particularly towards authority figures such as parents and teachers. According to ODD, children with ODD show a pattern of uncooperative, defiance, and hostile behavior towards peers, parents, teacher, and other authority figures. Next is conduct disorder. This often involves a tendency towards highly antisocial behavior such as stealing, fighting, vandalism, and harming people or animals. They have example is very irresponsible, skip school or run away, steal or do other things to violate the rights of others, physically harm animals or other people, such as committing assault or rape. Next is sleep problems. Finding it difficult to get to sleep at night and having irregular sleeping patterns. According to sleep problems, involves problems with the quality, timing, and amount of sleep, which result in daytime distress and impairment in function. Example is insomnia. Next is dysprasia, a condition that affects physical coordination. It means is a common disorder that affects movement and coordinations. Example is your child may take slightly longer than expected to roll over, sit, crawl, or walk. Now, let's proceed the conditions in adults with ADHD. First is personality disorder. Second, bipolar disorder. Third, obsessive compulsive disorder or OCD. What is personality disorder? Personality disorder is a condition in which an individual differs significantly from the average person in terms of how they think, perceive, feel, or relate to others. It means it's a mental health condition where people have a lifelong pattern of seeing themselves and reacting to others in ways that cause problems. Next is bipolar disorder. Bipolar disorder is a condition affecting your mood, which can swing from one extreme to another. It means it's a mental health condition that causes extreme mood swings that include emotional highs, mania or hyponia, and lows, depression. And the last is obsessive compulsive disorder, a condition that causes obsessive thoughts and compulsive behavior. For example, is a person who fears contamination with germs may wash their hands repeatedly.